Whether you're a serious athlete or a weekend warrior, one part of your body that is at increased risk of injury is your hip. While it's a stable joint, the fact that it goes in so many different directions means there's a greater chance of something going wrong. But what can be done to help with your sore hip, short of getting it replaced? Dr. Bantoo Sehgal from Essentia Health says your first step is to come in for an x-ray so they can figure out what's going on. He says depending on what doctors see, they might tell you to rest or give you a steroid injection to the spot to both diagnose and treat the injury. You might have something called hip impingement.
Hip impingement is a pretty new term, but we've been coming to discover that it's much more common than we thought.
Dr. Sehgal says hip impingement is when you have an extra piece of bone in your hip joint. So when your hip moves around, it hits the bone and causes pain. He says they're not sure how it happens. Some people are born with this extra bone and it doesn't cause any trouble. Others develop it from aggressive sports. Fortunately, those with hip impingement no longer have to live in pain or wait for a hip replacement. Doctors, such as Dr. Sehgal, are performing hip arthroscopy, a minimally invasive procedure that starts with 2 very small incisions instead of 1 large one.
What we do is we go in with a camera and we can shave down some of that bone and clean up what we call a labrum, which is on the end of the bone that gets damaged when that happens.
After the procedure, the medical team is ready to get you out the door fairly quickly. Patients can go home the same day and with a little TLC and ice can be on the stationary bike the very next day. Many patients report almost immediate pain relief because of their restored range of motion.
Very rewarding. I tell you, I see these guys go back to hockey and play on leagues and they feel great and it really helps them.
Dr. Sehgal says hip arthroscopy has only been performed in the United States for the past 5 to 7 years, so they're still not quite sure what all the health benefits might be. He says they hope in the future they might even prove it prevents arthritis. For Medical Insights, I'm Tracy Briggs.